Fiona. Good afternoon, everyone, and thank you for coming. I'd like to start again today by thanking all West Australians for their patience and understanding with the recent restrictions, all of which have been essential to minimise the risk of the spread of this dangerous and potentially deadly virus. I'd also like to acknowledge the outstanding work that's been done by our contact tracers, our testing teams, our health professionals and our police. They've done an extraordinary job in finding the answers we need for us to get on top of this virus and crush it. As we reported earlier this morning, WA has again recorded 0 new local cases of COVID-19, which is terrific news. That means we've achieved 4 successive days of no new local cases in our community, the exact result we need. 3 new cases have been identified among overseas arrivals, all of whom are in hotel quarantine. That means we have 28 active cases and 27 of those are in hotel quarantine with 1 person in hospital. As of this morning, a total of 1,819 people remain in our quarantine hotels, a number that is finally starting to drop with our reduced cap of overseas arrivals. Firstly, in relation to New South Wales, we are closely monitoring the evolving situation in Sydney, where a man in his 50s tested positive yesterday. Another local case was picked up this morning, and we have been advised the number of exposure locations has now increased to at least 19. This number is expected to grow. New South Wales authorities are continuing to contact trace. At the moment, there is no change in our border controls with New South Wales. However, any arrivals into Western Australia who have been to the exposure locations will be ordered to self-quarantine for 14 days and get a test on day 2 and day 12. This mirrors what we have done on 3 previous occasions. I've been advised that so far we've had no arrivals into Western Australia who've been linked to any of the exposure sites. That is welcome, but we must remain vigilant. We hope New South Wales can get on top of this outbreak quickly. We wish them all the best and we have offered our help should they need it. Back home, I'm pleased to announce some good news regarding case 1001, the security guard from the Pan Pacific. All 115 close contacts linked to case 1001 have now been tested and all are negative. I repeat, all close contacts associated with the Pan Pacific security guard and 2 of his Nollamara housemates have all tested negative. That is great news. Those close contacts all remain in quarantine. As has always been the case, close contacts will be required to complete a full 14 days in quarantine to give us extra confidence going forward. Everything is being done to minimise even the slightest risk of community transmission. So far, based on the information we have, there is no evidence of spread from case 1001 beyond his 2 household contacts. This is pleasing news and helps us to move forward. This morning I attended an emergency management team meeting to finalise our next step forward. Based on the advice of the Chief Health Officer and the Police Commissioner, we are now in a position to significantly ease the recent restrictions. From 12:01 this Saturday morning, May 8, restrictions will be eased back to what they were last Saturday, with a few exceptions. We plan for these restrictions to be in place for 7 days, up until 12:01 a.m. on Saturday, the 15th of May. The exceptions to the restrictions are based on the most up-to-date health advice. Masks will now only be required on public transport, events or venues with more than 1,000 people. I repeat, masks will now only be required on public transport or at events or venues with more than 1,000 people, and in hospitals, disability and aged care facilities. This is a significant relaxation on the wearing of masks, which can be done safely and based on health advice. This also means high school students will no longer be required to wear masks. Masks will also no longer be required at gyms or other fitness venues or at work. I know how frustrating and annoying it can be to wear masks. So thank you to everyone for doing the right thing during this period. From Saturday, people will be able to welcome up to 100 visitors to their homes, up from the current 30 visitor restriction. Nightclubs and the casino will reopen subject to the 2 square metre rule. Major stadium capacity will return to 75% during this period. But masks are mandatory at the stadium, RAC Arena, HBF or any major event with over 1,000 people. Visitors to hospitals, aged care facilities and disability centres will be limited to 4 visitors per day, but masks are mandatory. Many of you will welcome this significant relaxation of restrictions. It strikes the right balance given the ongoing unknowns associated with this global threat and where we want to go as a community. The reason we're able to ease the restrictions is because of the efforts of the people of Perth and Peel. People have followed the health advice that is there to protect us. We must continue to follow this advice and our healthy habits so we can return to pre-lockdown life. A lifestyle that is the envy of so many around the world, many of whom are still confronted by the deadly havoc the virus can wreak. Unfortunately, small businesses have been impacted by the necessary restrictions to protect us from the virus, which is why my government is committed to supporting small businesses. Last week, I announced a new grant would be made available to small businesses directly impacted by the lockdown. I'm pleased to announce that a register is now open for businesses to access the Small Business Lockdown Assistance Grants Program. This will see organisations affected by the recent Anzac Day long weekend lockdown benefit from $2,000 grants. The scheme will help a range of businesses, from cafes, restaurants, pubs and nightclubs to fitness centres, florists, cinemas and those in the events industry. Further information is available on the Small Business Development Corporation website. We've moved quickly to establish this one-off targeted program which will provide relief for thousands of small businesses. We estimate around 15,000 businesses will be eligible, with the estimated cost of the program to be around $31 million. I sympathise with those businesses who are unable to trade during this period. The last thing we ever wanted to do is close down businesses or put in severe restrictions that prevented business. But the most important thing is to keep COVID out of the community and prevent any long-term lockdowns or restrictions, which would have much more devastating impacts for business. The approach we have used over the past 14 months has ensured Western Australia's economy is the envy of the nation and the envy of the world. Again, I want to thank the people of Perth and Peel, and in fact the community of Western Australia, for your efforts to keep our state safe and strong. These efforts mean our state, our community and our economy continue to defy the ongoing threats thrown up by the pandemic so we can prosper in one of the safest places in the world. Are there any questions?
Can I just get you to clarify, beyond, or do you expect the public transport mask wearing to continue into the foreseeable future?
Well, at this point in time, it will continue for a week from Saturday. So that is the current advice. It is, I think, a very safe precaution, and on public transport, of course, people are often crammed together and you don't know who you're near, so it's a very safe precaution. The other component of it, of course, is if you go into a hospital, if you go into a disability area or centre or aged care facility, you're required to wear a mask. And of course, if you go to an event over 1,000 people, you're required to wear a mask. It's a significant reduction in the mask wearing requirements, but we've done it on health advice. As to whether or not we would extend it beyond the end of beyond Saturday week, that would be subject to further advice.
What about people in regional WA who have been in Perth or Peel? What are the mask requirements for them?
The same. So if they use public transport, if they go to a event of over 1,000 people, they go to a hospital, a disability centre or to an aged care facility, they're required to wear the mask for that period.
Is this the longest period we've gone with having to wear masks?
I think so. I think so. Obviously, masks can be annoying, but they do help protect us. And so I think it's a good measure, frankly. It's a good measure. I expect many people want to continue to wear masks when they're on public transport or when they're in crowds. You often see that in other parts of the world. It helps protect you from a range of illnesses, not just COVID.
Do you think it's something that needs to change? Do you think we should just always, regardless of whether or not they're mandated, that we should always just have one on us?
Well, we're not mandating that at this point in time. I know some states have done that. We're not mandating that at this point in time, but I suspect some people will elect to do that. I don't know about you, but all winter, getting a cold or a flu is an appalling experience. And last year I didn't have one. And that was actually one of the upsides of what occurred last year. And so having a mask available and maybe wearing it when you feel like you're in a position where you could acquire an illness is not a bad thing.
Will the birthing partner regime wind down on midnight Friday as well?
Yes, that's correct. So it will allow for 4 people, family or what have you, to be present if that's what you want, but they'll be required to wear masks.
Groups are calling for more certainty as WA may go in and out of lockdowns around those arrangements. Can that be implemented so that the sort of stories we've heard over the last week or so with birthing mothers, we don't hear them again over future lockdowns?
Well, you can't give certainty. We don't know what might happen in the future. The best way to give certainty is for everyone to get vaccinated. So the sooner people get vaccinated, the sooner our whole community gets some sort of immunity, the more certain we'll be. But at this point in time, you just don't know what the world holds in store for us. So we've done our best to protect us over the course of the last 14 or 15 months. We'll continue to do that, but you just never know what's around the corner.
Is it your hope that WA will snap back to pre-lockdown restrictions from May 15?
Well, that would be my hope, but that would be subject to what occurs over the course of the next 8 or 9 days. But the restrictions over the coming week are relatively light touch. They're relatively light touch. And I think they'll be welcomed by many people, but there's still restrictions. So we just urge everyone to adhere to them.
Given that around 30% of the security guards who man the hotel quarantine system haven't received the first dose of Pfizer, on Monday, does that mean you lay off 30% of the staff, and how is that system then managed?
I might get some advice by the Health Minister on that, but I just urge all those people working in hotel quarantine who haven't had the vaccination to get the vaccination. Obviously, we're winding down the number of hotels, so I think it will become a much easier thing to manage because we are winding down 3 of the hotels. So that will become an easier problem to manage because we won't require some of the staff that were in some of those hotels.
When will those 3 hotels be wound down to closed?
Once we're able to get all the people that are in them out safely into the community or back to their home states, we'll be able to do that.
There's not new people going in there,
them.
No, they're not. Well, one of the hotels will be set aside, I think it's Novotel Langley, for people who are coming in from Tonga or Vanuatu who are seasonal workers. So one will be used for that purpose, and that's for the agricultural industries of the state. The other 2 will be exited.
So these relaxations, and they're pretty significant. They're occurring within the potential 2-week incubation period from when we first found out about the Pan-Pacific cluster. Is this the government putting a lot more faith in its contact tracers and faith that they have managed to contain whatever cluster could have emerged from the Pan-Pacific?
Every situation is different. Every situation is different. And what we've found is with the Pan-Pacific cluster, we've managed to test all of the close contacts and they've all come out negative. All the casual contacts, we've had very strong testing regime and everyone has come out negative apart from the cases we identified at the start that went into hotel quarantine. So done everything we can to make sure that we can take these steps. And every step we take is based upon the best of health advice. So the health advice is there that we can move to these measures. Over time, our measures evolve. If you look back to what we were doing in April, May last year, it was quite different to what we're doing now. But we'll continue to be cautious. We'll continue to take a precautionary approach. The approach we've adopted so far has worked, and we just want it to continue that way.
But are we less?
Premiers take aim at our lockdowns.
I'm sorry, I couldn't hear that.
The New South Wales Premiers take aim at our lockdowns while defending the way they're handling this recent breakout over there. What do you think of the way they are doing it? Should there be broader lockdowns in Sydney, given the unknown link between their two cases?
Look, obviously Sydney's going through a difficult period, as we have before. I just want to wish them all the best and offer our help and support. We obviously have contact tracing teams ramped up. We've made an offer of help if they need that. And I think it's at times like this, we all need to work together, and that's what we plan to do with New South Wales. If they'd like our help, we're there for them.
The New South Wales Premier said that if there had been a mystery case detected in Perth, like we've seen in Sydney overnight, you would have locked down the entire city. Is she right?
Well, we've had various situations, and we've had to deal with multiple cases in recent days where we've had to take steps, including some multiple cases that we had to take action over. But look, I'm not going to get into a tit for tat with Sydney that's now going through a very concerning period. I actually want to work with them and help them. So our offer of assistance is there for New South Wales if they'd like the help of Western Australia with our contact tracing teams, whatever it might be. We're there to help our brothers and sisters in New South Wales.
Those comments are pretty unhelpful, though, particularly from a Premier who is dealing with that situation.
Yeah, no, as I said, I'm not getting into a tit for tat. All I want to do is help New South Wales. They're obviously going through a difficult period, and we don't actually know where it's going to end. We don't know what's going on in Sydney at the moment. I don't think anyone does. So if we can help them, we will.
When are you sort of expecting your next update from them? Is it coming pretty consistently? Or?
Oh, well, we see it publicly like you do.
Given it is a mystery case and there is so much mystery surrounding what's happening in Sydney, why have you resisted the urge to shut the border?
Well, that's based on health advice, and we followed this this regime on at least 3 occasions before. You wait to see what happens, and that's what we've done in relation to Brisbane twice, Byron Bay once. We'll wait and see what happens. Obviously, if it spreads in Sydney, we may well make a different decision.
Premier, can you just clarify, the mask restrictions for people in the regions, the time frame, is it if you've been within Perth and Peel in the last 14 days that you have to wear a mask, or for the whole week?
14 days. Yeah, if you've been within Perth and Peel within the last 14 days, you'll have to wear a mask. If you're on public transport, if you're in a hospital or disability centre or a aged care facility, or if you're in an event of over 1,000 people, that kicks in as of Saturday morning.
Regardless of whether you've been in Perth or Peel, even just in
No,
general?
no, only if you've been in Perth or Peel.
Okay.
So AFL matches, full crowds again, or?
75%. Bear in mind, I don't think there's a game here this weekend. But they could have had a 75% game, but we didn't know that at the point in time the Dockers had to make a decision. And I think they made the right decision to hold their game in Brisbane. We'll get a home game later in the season. They took a cautious and I think quite a wise and sensible approach to move over there, because you don't know what could happen. As we know, COVID is unpredictable. You don't know what's around the corner. As it turns out, most probably they could have held a game here this weekend with 75% crowd, but they made the right decision in the circumstances.
So the next home game is the Eagles at Optus Stadium on Sunday the 16th. Do you expect 100% capacity, no masks?
We'll get advice on that later this week as to what exactly it will be. If it was this weekend, it would be 75% and mask wearing. What it will be by the following weekend, we'll be able to inform people during the course of next week.
Premier, I'm not sure if this one's for you or for the health minister, but I'll ask. It's obviously there are people out there now that are coming up with ways to try and beat COVID, and there's particular purifier systems they're trying to sort of talk to government about within hotels, air purifier systems. I mean, do you take this stuff seriously, or do you just leave it to other people to see whether these things are actually going to be helpful?
We've got to be careful with these things. So as you might recall, we had to ban what's called nebulisers in people's rooms, because it turned out, I think there was a case in Melbourne where a nebuliser in the room managed to somehow spread it across the corridor and into other rooms, and therefore people got unwell. So nebulisers are one thing. We put what's called HEPA filters into rooms with people who are positive to purify the air. but we take the best of scientific advice. I mean, you just always got to make sure that you follow the best of scientific and medical advice on these things. If people have ideas they want to put forward, of course we'll consider them, but if they make the situation more dangerous or they don't make any difference, well then we wouldn't use them.
Given because we didn't have to go into a second lockdown because of the security guard case, does that give you a bit more confidence in the testing and tracing capabilities that we've been able to see over the last week, and give you any more confidence to maybe avoid a snap lockdown in the future?
Just depends on circumstances, Eliza. You can't pick these things. I'd rather be cautious than make a mistake. But our contact tracing and our testing regime has always been very good. And I know it's been subject to some criticism, but it's always been very good. We ramp up very quickly. Lots of people come on board from all sorts of agencies. In fact, people from the Commonwealth come and assist us as well. So it's been a very effective system. It's just we've always been very cautionary and very precautionary. So, I mean, you know, that's been our model. As I've answered this question basically every day about, our approach over the last 15 months, but like many people, I watch Facebook and I watch the news and I see what happens in other countries, and I just want to do everything I can to prevent that from happening here.
I asked what your thoughts are on front of the paper. I'd asked the question, what is Perth? What is it to you, and do you think people overseas and over east know what Perth is?
They can't come here.
Is there a bit of
Well,
a
over east they can. Hey?
Is there a brand? Do you think we've got a bit of a branding
Well,
problem? Does Perth know what it is?
Of course we know. Well, we know what we are, but if we can improve, well, that's a great thing. So if there wants to be a consultation about redefining our brand, that's a good thing. Everyone I know, from over east or overseas, whoever comes here, reckons it's the best place they've ever been to. That's a very common sentiment. I met a couple, in fact I met a few couples. You might remember that we basically stopped vast majority of interstate FIFO. I was at Kings Park filming some ads actually, and I met these couples. They were there having a picnic looking out over the city, and they'd come from Melbourne or Sydney, and I went over to say hello, and I didn't know they were from Melbourne or Sydney, and then they said to me, "You've made us leave Melbourne and you've made us leave New South Wales to come here." And I thought, uh-oh, this isn't going to go well. But they said, best thing we've ever done, best thing we ever did, because it's such a delightful place. And there they were on the escarpment at Kings Park looking over the city, and they said it was just the best move they ever made. Housing's more affordable, the lifestyle is better, the job prospects are better, the capacity to own your home is better, raising a family is better. I think we should be very proud of ourselves. So I think we shouldn't talk ourselves down, but if we can build a better brand for ourselves, well then that's a good thing to do.
Just back on
why isn't building more homes a higher priority, especially given the surplus we have and the high number of homeless?
Well, building homes helps with providing capacity. So we want to free up more rentals, we have to build more homes. And getting people into their own home is a great Australian ambition, and I've always supported it. So other countries around the world, ordinary people don't own their own homes. In Australia they do, and that's a good thing.
Premier,
The emergency
the
response
recent...
group, sorry, just one more on that. The emergency response group says there's 30,000 people still waiting to get accommodation. How do you feel knowing that there's such large numbers of people that are struggling while our rental market is soaring?
Well, we've done all we can to get more rentals on the market. The recent figures since the lifting of the moratorium have showed an expansion in the number of properties available, and we are building and providing more social housing. We're investing hugely into homelessness services, and we've got the biggest building boom of new houses in the history of the state, certainly in recent history, certainly in the last 10 years at least. So we are, the ABS figures came down yesterday that showed Western Australia is leading the nation in terms of new builds of houses. What that does is when you have new builds of houses, you keep 65,000 people employed. You then free up rental properties. And when you free up rental properties, you'll actually, due to market forces, make rentals more affordable. So we're actually doing a lot of things to try and address the situation. What's happened over the course of the last 14, 15 months, I think a lot of returning Australians, or people returning from overseas at least, are buying or building or renting. And that's put a lot of pressure on the system. And it was unexpected at the start of COVID. We didn't know this was going to happen. No one did. But what we did was responded, and we responded with a massive home building program that will, in due time and in due course, free up more rental properties for more people.
Just back on COVID, have you advised the Prime Minister what WA's overseas arrivals, weekly arrivals figure will be going forward?
Yes, I have. We'll be able to take 530 people per week. That's a significant reduction, but we're going to be very precautionary with our hotels. And that's the same as South Australia. So we'll go to the same model as South Australia. I realise that won't be appreciated in Canberra, but I want to do everything I can to prevent any outbreaks from hotels in the future. Admittedly, hotels were never built for it. They're not purpose-built quarantine facilities, but we're going to do everything we can to prevent further outbreaks out of hotel quarantine.
Premier, that housing...
The Prime Minister has accepted that figure going forward?
No, I haven't. I've written to him.
So you essentially determine the figure, don't you? It's not up to him to approve it. You tell him.
Well, we'll tell them what we can take. We're basically, as you all know, we're doing the job of quarantining, and we'll take what we can. We were taking the most per capita easily of all the states. Whilst New South Wales was taking greater numbers, we were taking the most per capita. And the reason that's relevant is, of course, New South Wales, for instance, Sydney has, 4 times as many hotels as we do, so they had greater capacity to take in people. But the recent outbreaks shows us that we have to be more cautious, and whilst we've done everything we can to make them as safe as possible, we're going to reduce the load so that we can continue to safely take back returning people, and we can protect the community at the same time.
You're going to look at anything to try and...
dug in on not using federal quarantine facilities. Like other states, would you float a plan to build our own self-contained facilities to get people out of hotel?
Oh, well, we're doing a review of all those sorts of things, but that takes considerable time, and there still is risk involved in that. Imagine if we spent hundreds of millions of dollars on a new facility and we still had outbreaks. Nothing is perfect in this environment. The Commonwealth currently has facilities, as I've said multiple times. They've actually used them for returning Australians. They've actually used them before. It's up to them to use them again if they want to.
Premier, the compensation grant, we've spoken to a number of regional businesses who are outraged that they've been excluded. Many of them have lost tens of thousands of dollars through a lack of tourists coming from Perth. Yesterday you said you had to draw a line somewhere and be fair on taxpayers, but they say they're taxpayers too. Will you really not consider extending the grant to regional businesses? Look, the lockdown was in Perth and Peel, and that's the area we're concentrating on because that's where the lockdown took place. Obviously, in terms of tourism, over the course of the last 14 or 15 months, it's been the strongest period in tourism in regional WA, in the history of WA, in history. Sorry, I've repeated myself there. I'll say that again. Look, the lockdown was in Perth and Peel, and so we concentrated on the area where the lockdown was, but regional tourism has had the strongest growth in the history of the state over the course of the last 12 months.
Just a welfare check. Any side effects from your vaccination?
I'm good, Gary. You and I are the same age, so I urge you to go and get yours done.
That's why I'm checking.
Yeah, no, I'm still here. I'm still here. So, Gary, you go. If you like, I can always...
Put in a good word for me?
No, I can deliver the injection if you like.
Just in terms of homelessness, a couple of the suggestions this group's offered up are purchasing vacant apartments to use as rental homes or using vacant government land to build quick modular homes. Are they solutions?
Who's that?
That's the emergency response group, housing emergency group.
And what have they offered, sir?
They've offered up 2 things, so spot purchasing vacant apartments to use as rental homes or the use of vacant government land to build quick modular homes.
Well, we're looking at all those options. But obviously the housing market is very, very strong. So there's huge amounts of building going on as we speak. It's really almost a capacity. I think it is a capacity. So there's very little capacity to build anymore as we speak. because the economy is so strong. These are some of the pressures we're up against. If private, as you know, buying a house or an apartment at this point in time is actually very difficult because the market is so strong. What we've got to do is just get more supply out there as soon as we can, which is what we're doing, and provide support to homeless services, which is what we're doing.
The
Beijing has
work
cut
was
off
also
all
called
diplomatic
for-
ties with the Australian government.
Sorry?
Beijing has cut off all diplomatic ties with the Australian government under the Australia Strategic Economic Dialogue.
I don't know what that is, I'm sorry.
I think it's for ministers and to kind of connect with each other. Is this a concern to you?
I don't know the details, but my position on relations with China is very clear. I think we need to rebuild the relationship, and I think we should stop language about war and conflict and hostilities. I don't think that sort of language is helpful to anyone, and I expect the Australian public wouldn't like that sort of language either. I mean, that's frankly, that sort of language I think is just, when you're dealing with a superpower, is not wise.
Has
Is
the
the government
government
wrong to try to unwind that Darwin port deal with the Chinese?
I'm sorry?
Is the government wrong to try to unwind that Darwin port deal with the Chinese?
I think it was done by the Liberal Party. I think it was a Liberal Party deal, so, Liberal Party did the deal, it's up to the Liberal Party.
Quick question for the Health Minister, because we have to go, guys.
Elthman?
Just ask quickly, is Kalbarri ready to reopen?
Yeah, I think the road is reopening shortly. All of the safety checks have been done to make it as safe as possible. I know a lot of the businesses in Kalbarri want tourists back, and our commitment when we went there, both the Minister and I, was to reopen as soon as we could to get tourists back. So as long as it can be done safely, it's a good thing. Thank you.
Minister, can I ask what happens on Monday when around 30% of the security guards who are across the hotel quarantine system can't work there anymore?
Yeah, so I'm advised the department has been already working with the hotel quarantine facilities and the contractors responsible for the staffing of those facilities to really explain to them what's going to happen on Monday and ensure that they have the staff available.
The reality is they'll roll into work and not be allowed to be there though, so that means we've got 30% less staff able to manage the system from Monday.
Yeah, and we won't simply allow the system to roll into Monday unprepared. We will do lots of preparations. We've been undertaking that work this week, and we'll do it over the weekend to make sure things stay operating smoothly.
Does that mean you're bringing in new staff, and how many?
Well, look, I don't have the details in terms of new staffing. As we've explained before, all the staff that work in our hotel quarantine are trained in infection protection control, PPE use and things of that nature. So you simply can't replace them that easily. So that's why we're working with the hotels this week to make sure that we can transition to next week smoothly.
What happens to the contracts with the security companies, the 3 hotels that are being moved on?
Well, look, many of the contracts operate between hotels, so the contracts will obviously remain in place. They are working with each of the security companies to deal with the changes that are occurring as we go along. That includes, for instance, the situation with regards to vaccination of all staff in a quarantine area. It involves the ebb and flow of the hotel capacity.
Is there a risk then that if we have those contracts still in place, then we're paying security guards not to guard hotels?
No.
What is the current vaccination rate for that cohort who are captured by the mandatory vaccination rules from next week?
Yeah, so at the moment we have well over 90% of all healthcare workers in quarantine are vaccinated, over 80% of all hotel workers are vaccinated, and upward of 70% of all security guards have been vaccinated. When I say vaccinated, received at least 1 dose. So that work continues on, and obviously I'm sure there'll be a lot more focus in the lead up to Monday the 10th to ensure that that every worker who wants to continue to work in those facilities does receive their vaccine.
The 64-year-old WA woman who's had a blood clot after receiving the AstraZeneca jab, what can you tell about it? What's her current condition? Is she hospitalised?
Unfortunately, I can't provide you any information at this stage, so I apologise for that. We're not sure if it's the case that was related to Fiona Stanley Hospital or if it's a new case. This is information which the TGA has released, so we're just waiting to get some more information in relation to those cases. And I believe there were 5 that are associated with TTS, and that the TGA are investigating at the moment. So we'll wait for further information from the TGA.
Last question, guys, got to run.
Do I know how case 1001 contracted the virus? Yeah.
Oh, look, you mean in terms of the incident in the pan pack itself? Not as yet, but obviously, like any incident, it'll be subject to a report.
When will that be completed?
Well, it will be completed as quickly as possible. So some of these reports can be undertaken, inquiries can be undertaken fairly quickly. The one, for instance, around the Mercure, we have to wait till that facility is vacated altogether. So sometimes they take a short period of time. Other inquiries take a bit longer.
Thanks, everyone.
Just a question for Andy, once the politicians have departed.
Oops. Thanks, Andy.
Are you less likely to advise a snap lockdown the next time the virus escapes hotel quarantine, given how successful contact tracing has been?
Look, I think, as the Premier said, each situation is different. It really depends on, what the cases are, what the links are, if we know whether they are mystery cases. So, and we'll provide advice accordingly. But I think we've used a couple of models and we've reacted appropriately where we have concerns.
Given contact tracing was relatively untested before February and you've now had to do it 3 times, have you got renewed confidence that that is a successful model?
I think what we've shown is that our testing and our contact tracing is match fit, if that's the right word. That they have actually, I think there was some concerns early on, but we've now gone through 3 recent outbreaks, and I think we've been able to show how rapidly we can identify, contact and test those people, get them into appropriate self-quarantine, and then to manage that cohort. And that's been to our benefit because that's allowed us to make decisions on easing restrictions, I think, in appropriate time frames.
But surely that gives you more confidence to avoid a lockdown in the future if contact tracers are matched fit.
I think, again, it depends on the situation that we have. So we have to actually look at the various situations. So if we had, for example, an event like New South Wales in the Northern Beaches area, is obviously very different to somebody we know that has been infected in a hotel quarantine setting. So I think it has to be a case-by-case basis, and we can make decisions based on that. That will best reflect the public health risk.
Are there that many ways that the virus can enter the community these days? I mean, surely you can plan for a mystery case, a case from a ship or somewhere along the hotel quarantine chain like that. I mean, they're the only ways it can get into the community, right?
Those are the principal ways of getting into the community, are through either through our airports, through our hotel quarantine, through our seaports, or from interstate. So we have to, if there were, for example, outbreaks in other jurisdictions. So we need to adjust for that, and we do continue to review and refine our processes going forward.
But can we not come up with a standardised response? I mean, there's not actually that many ways that. 4 or 5 ways.
Well, the issue is not necessarily how many ways there are. It's around what impact is, in what communities are we talking about. So if we had an outbreak, for example, in an aged care facility, we'd obviously be managing that quite different to one case that we know is related to a quarantine worker. So we have to have the flexibility to be able to deal, as a public health response to whatever the events present. So that's why it's not a matter of simple templates. It's around being able to assess the information, assess the the risk to people and then make appropriate management plans.
What are the circumstances around the New South Wales sort of mystery case that gives you confidence not to shut WA's border?
Well, I think at this stage they've obviously identified this gentleman. They've tested a number of the close contacts who, with the exception of his wife, have all been negative. They've also identified, they've actually done the upstream tracing of that and identified the case that it was related to within their hotel quarantine system. And we know that when that case arrived into that system, we know that's actually a relatively short time frame. So while they're still are looking at for an intermediary between those two cases, I think we're fairly confident that it'll be one intermediary, not a lot of cases. So, and given their very robust contact tracing and testing system, I think that gives us some confidence. But it could change. The intermediary could have spread to other people. We could have other cases out there that we are yet to be aware of, and obviously we will need to consider that in future days if that were to occur.
Andy, has there been any discussion with people who are marketing these air purification systems for hotels? Have you had those sort of discussions? We've
had some preliminary discussions with those companies. We get these all the time. Some are newer technologies which we would be interested in considering. Others are older technologies that we actually have concerns about. As the Premier said, there are systems out there that some of the ionisation systems, for example, produce ozone. Now, ozone's not great to have. If you're in a room full of ozone, you're probably going to do more damage to your lungs than from the disease. So we need to be very cognizant that they may, at best, be no better than what we currently have with our HEPA filter systems, and in some cases could be worse. But we will continue to look at the systems.
The decision to indefinitely halve WA's weekly arrivals cap, is that based on your advice?
Yes, it is. We've had, obviously, as we are slowly transitioning out of 3 hotels, and one of which will become for agricultural and seasonal workers, that's obviously decreased our capacity. We also need to be able to deal with increasing rates of disease coming in from overseas. So, and that at times will require us to free up rooms around various passengers and things like that. So it's not a matter of we've got 100 rooms, we can put 100 people in it. We have to actually do the calculations, and that will allow us to deal with any of those people coming in. It also allows us, we do get a number of people coming in that we have to deal with, people like maritime off-signers. These are people who coming off ships. We need to accommodate them for 1 to 2 days before they fly out of the country, and to do that in a safe manner. So, so we have to be able to deal with all of those contingencies.
Have you had any feedback from other shows across the country on our stance? Around the cap?
No, not at this stage, no.
There's obviously a political fight between the states and the federal government about the use of defence and immigration detention facilities in WA for quarantine. Do you think that it would be appropriate to put return travellers from India at Curtin Air Base or Christmas Island?
Look, I think we provide public health advice as to whether they're appropriate or not. I think obviously the discussion as to between governments is one for the Premier.
And what was your advice regarding those 2 facilities? Are they appropriate?
We haven't, because Commonwealth has obviously said that those weren't appropriate. We haven't had the opportunity to assess them.
And have you looked at any alternatives aside from hotels in Western Australia?
Look, we periodically have people come up with suggestions, and we look at those suggestions. Some of them are never going to be practical. We do need, there are certain requirements. Obviously we need to be able to get people to a facility. We need to have access to medical care near that facility. if people become unwell. And you'll be aware that over the last couple of weeks, we've had 3 people in hospital who've come out of our hotel quarantine. So we have to be able to accommodate those. So there's a number of basic criteria that they would have to meet.
What are the alternatives to hotels that you're looking at right now?
At the moment, there's no specific alternatives that we are looking at.
Okay, thanks everyone.
I can't just.